is Kayla Lindsay, and this is the interview reflection video for the capstone class at Liberty University. I am doing my video for Joanna Ramirez. Joanna is a BCBA clinical supervisor. Joanna has gotten her master's degree at FIT. She got her master's degree as a Master of Arts in Applied Behavior Analysis. Joanna's job duties are pretty much takes does intakes for ABA therapy, and where she brings in the kids and they pretty much look over all of the things. They look over behavioral things where they're watching for anything that the kid may do as far as engaging in any type of tantrums or verbal protest or crying behavioral things. They also look for any fine motor skills, gross motor skills, things that they may lack or, that they may need, for therapy. And then they, write up this treatment plan. They send it off to the insurance. So, and once they get it back for the insurance, they also supervise and train their ABA techs so that their ABA technicians can provide these services for their clients. These also go hand in hand with their parents, for especially for their behavioral things where if they're maybe lacking anything at home where they're trying to help with the client may be struggling with bedwetting or something like that. The BCBA, giving the parent some type of assistance with the parent with that. They also provide direct therapy occasionally with their clients, just to get to know them more and more. They also do program modification. They do graphing data, just to name a few. I also asked Joanna, what would you find fulfilling about working in the industry? And Joanna, when she talked about this, she said that when she was a RBT, she was pretty much like, oh, just seeing the clients make progress, that was all that she was like, that was helpful for her. But now that she became a BCBA, it was just like, being able to teach the client, being able to teach the RBTs was so like great that it was like being able to generalize that, like, hey, I could teach this RBT to now to teach this client that, you know, I can be able to teach, just not this one skill, but, they can be able to take it from this client to this client, basically being able to take it to multiple clients. And everybody's learning, everybody's getting the same opportunity, and just basically everybody's getting a learning opportunity and not just one person. So she's basically helping everybody. So she just love helping everybody, and that's what she's getting the most fulfilling thing about the industry, is just helping multiple people and not just the clients, but helping the RBTs as well. The thing that she did say that she find very challenging was the diagnosis. She ran into a lot of undiagnosed kids, where she potentially seen an undiagnosed kid, and even though it wasn't diagnosed, she seen the diagnosis. So it ran a lot into therapies where she couldn't provide a certain therapy because this was in the way, and a lot of parents were coming to her and just like, hey, I see this, but we can't fix it because the doctors, they just not really giving their all, because so it was just a lot of struggle when it came to the undiagnosed just the undiagnosed things when it came to doctors and things like that. So it was just a lot of therapy, ABA stuff that wasn't diagnosed in the mix of it. So that was pretty challenging for her. I also asked her, what do you do to continue professional growth in the field? She says she watched a lot of educational podcasts, and this is just to kind of keep her up with, what other people, got going on. She does a lot of videos. These videos and podcasts, they do, like word knowledge, especially when she, you know, kind of in and out of things, even though like for them to stay in the field for BCBAs, they have to do, it's called CEUs. They have to renew them every 2 years, and so for those 2 years, if you go ahead and get them out the way, you still have 2 years left, and you're pretty much not doing nothing. But so she's just kind of, kind of staying up to speed by doing her videos and her podcast to kind of just stay up to speed and, just kind of trying to stay fresh. She also was, reading articles, especially when she get lost. If it's a new case for her and she just like got a lot of questions and, she needs some more insight. She was like reading up on, different articles, to see if if somebody else had a some type of kid that was kind of resembling hers. So that's what she was doing for that. I also asked her what kind of recommendations she had for any students that were potentially going in the field that she was going in. And she had a few recommendations because she said this field is not easy. It takes a lot of patience. So she pretty much said, if you're burnt out, it's please, please, please advocate for yourself. If you need a break, ask for it. Like it's not easy. You're seeing so many different things going on, behavioral things. It's a lot of it's time consuming. Like you don't see change overnight. So you have to speak up for yourself, speak up for your client. Hey, this is not working out. I need help in this area. I need a break. Even if it's like, hey, I need 15 minutes, please ask for it. Hey, can I get a week off from this case? Or hey, I need a week off from work or a couple of days off from work. Please advocate for yourself. She also said to work in multiple settings, because she said in multiple settings that you're going to see different things. She worked in clinics and in home, so she said that she got to see more naturalistic in home than she did to see it in clinic. And it just was, a better vibe, or it was a better vibe to do natural in home than it was in clinic. But she likes the more structure in clinic, so she stays in clinic more. So yeah, so I really love this assignment because it just, I got to see, pretty much like the life of a BCBA. I interviewed her because I'm in hopes to one day become a BCBA. I would really, really love to do it. So that's why I got back into school to become a BCBA. And I'm almost finished with my bachelor, so I'm excited. So this is, I'm trying to drive and push to keep going and keep going. So this is why this is, exciting for me. So yes, but thank you for this opportunity. God bless.